right, I'm going to start us off today. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber, and I want to thank you for joining us for this week's Retail, Personal Services, and Limited Healthcare session. Again, we have these weekly because things are changing pretty fast. Jesse will talk through some of the recent changes as of yesterday overall in our new landscape. And this is a great opportunity for you to ask your questions, to provide feedback, and to get new information. We will be sending some links following this on some feedback that the state is requesting, and they're requesting it by tomorrow and Thursday on some next steps. So make sure to look out for my email and to submit that feedback, because as we've learned, the feedback does matter. At this time, I'm going to hand it off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. So I'm going to jump right in so we can get to question and answer as quickly as possible. And what I'll be doing today is just giving you some general updates, pretty much the same format as we've been doing for the last couple of weeks, with some focus on resources to support you and your businesses, and then jump as quickly as we can into sector-specific information and Q&A. So in terms of the timeline, and we've been going over this a lot for the last couple of weeks. Really, we haven't seen any changes to the order since the 6th of June. However, last night, the governor and the state put out draft guidance that is, they're looking for feedback. So these are not in effect yet, and their guidance on camps and indoor and outdoor events. And those, they're asking for feedback, and I'll get into a little bit more detail on that, for those that would go into effect relatively soon. And then they're also, they've rolled out this future evolution of Safer at Home into Protect Our Neighbors as a framework for the next phase. And I'll go into detail about how that will work. But that came out yesterday, and we expect some of the things that came out yesterday to go into effect in the near future. And like I said, we are still in Safer at Home, and it's going to evolve, and that's really what that future framework discussion is about. It's how will this evolve? How will this change for individual communities? That's the way it's going to be for a while. It's not going to change much. There's going to be small changes, tweaks over time, and that's because we don't have a vaccine, we don't have a successful treatment, and we certainly haven't reached herd immunity yet. And so that's where Safer at Home came from, stay at home, and now there's the chance we'll be moving to this Protect Our Neighbors, or whatever they end up calling it. And all that's because COVID-19 is still just as contagious as it was at the beginning of the year. So we're still recommending that you stay at home as much as possible. And I just want to remind you that symptomatic employees really should be encouraged to stay at home. It's the best way to keep them safe and your other employees safe. We've had a lot of concerned employees contacting us, customers contacting us about seeing employees that might be symptomatic, and that can have an impact on confidence, but it can also have an impact on your actual staff. So please encourage employees to stay home if they're experiencing symptoms. And finally, if you have specific questions about your business or how your business might comply with some alternative to what's being recommended, contact an attorney. They're your best bet for very fine-grained information. So the Boulder County face covering order is still in effect, and the county, along with the chamber, produced these great posters that I've linked to here that have that illustrate all of the situations in which either your employees or patrons would need to wear masks, and the types of masks they need to wear. And also, and we can link to this later, we can bring it up later, the face covering script has been updated. We had one about 2 months ago that was pretty binary in terms of how you would navigate a conversation with someone who didn't want to wear a mask. This new one is very, it goes into a lot more detail, and it provides a lot of alternatives for a customer who's not willing to put on a mask for still obtaining services from your business. And just want to highlight again the various resources that we have out there. boco.org/COVID-19 business is the county's website. We link to a lot of information from the state, but we again have Boulder County specific information like that face covering ordinance. And then covid19.colorado.gov is the place where the state puts their latest guidance. It doesn't always update right away, but it is the best place to get specific information. Another place that will come up today that Cami and I definitely will discuss is the Department of Regulatory Agencies. It's another state website that has detailed information for very fine-grained industries. So you can look back over time on that website about how orders have changed for specific industries. EnergizeColorado.com is a great place to get resources, physical resources, cleaning supplies, masks, PPE that will help operate your business. And all right, I'm going to give this a shot. I don't know how it's going to work. Let's see if I can get it up here and show you all. I'm going to. Is that on the screen? Can everybody see that? All right, yes. Thank you. So I'm really glad this was here again, so I didn't skip over it. I just want to show that basically what we've tried to do is outline the various ways that you can interact with a customer who's not interested in wearing a face mask for whatever reason. It could be health reasons, it could be a religious exemption, anything like that. You do not have to let them into your business if you don't feel safe. You can offer other ways for them to access your services, and that is completely compliant with the law. So that's really what that service is, or that script is really great for. Let me run back to my presentation here. And just one moment. So in the past, in these sessions, we've sort of given you some guidelines about how to report an outbreak. Unfortunately, there's actually been a number of outbreaks in the county recently, and this has knock-on effects that I'll talk about in a little bit. But these slides came directly from our epidemiological team, and they wanted us to put this information out there because it really should let everyone know that we can't let our guard down in terms of sticking with social distancing, wearing masks, and following the guidance from the state. There have been 3 confirmed active outbreaks, and there are 3 suspected clusters as well. In the last little while, we've resolved 2 outbreaks, which is great. And in the last 6 weeks, since the outbreak, since the onset of this, there have been 45 workplaces assessed for, they announced that they had an outbreak, and then we've had 6 in the last week. So there seems to be a ramp up in cases, and that's alarming. It should be concerning to everyone, and not just for our public health, but also for reasons that I'll get into in a little bit. And in terms of, this is again from our epidemiological team, in terms of how to reduce the risks, continue to conduct those daily health checks. Almost every industry that we speak with is required to do those. If you have a sick employee, ask them to stay home. Conduct a hazard assessment. Look at your workflow, look at your business model and see where there are points that where there is increased risk of transmission, and try and focus on protecting the people working in those situations. Cloth face coverings and social distancing. We say this about every industry, about your private life. Wearing a face covering when you can't maintain 6 feet of distance, and then 6 feet of distance, are your best ways to avoid transmission. Improving building ventilation can be a difficult thing, but it can be very easy. If you have windows, open them. Fresh air is a great way to, fresh air flow is a great way to improve ventilation. If you have access to your ventilation system, if you know that it's being serviced regularly and has been serviced recently, that's great. And making sure that it's using the best filters that it can. There have been cases in the past where people have tried to get the best filter on the market and install it in their existing ventilation system, and that has caused the ventilation system to fail, which means that you're not getting any air cleaning at all. So be cautious about this, but do definitely, if you have the opportunity, look into your ventilation system. And then finally, report any confirmed COVID cases to Boulder County Public Health. We will track them. We will work with you as a business owner or staff to work through your business model, again, trying to find the areas where you can better protect your employees and your customers. So I mentioned that the outbreaks had an impact. Our variance requests, one of the big requirements of a variance request is that you meet certain targets that the state set in terms of the rate of new cases and the rate of hospitalization. And the outbreaks that we've had recently have resulted in us falling below that threshold. And so we actually cannot apply for a variance right now, but that does not mean that we are not seeking to do so. So we're still asking for your guidance. We're still asking for your suggestions, and we're taking those and we're crafting a draft variance language. And to reiterate what we talked about last week, variances are from the county to the state. They are not business by business, and asking us, we can't grant a variance. We can only ask for a variance from the state, and we would do it on a countywide basis. And the reason for that is what we want to do is create basically a public health order that that smooths out the unusual circumstances that various businesses have to operate under, come up with some sort of, or a small set of standards that everyone can understand. But again, the status right now is that we cannot apply for a variance because we do not meet the threshold. So the draft guidance that I mentioned before, and will probably come up again, yesterday afternoon, they released draft guidance for residential camps, outdoor events, and indoor events. And they asked for comments by tomorrow at 5 p.m. And so Corinne's gonna send out in her email an opportunity for you, links to those comments, comment forms, and please fill them out. Corinne has said it in every other session, so I'm gonna steal her thunder here and say that it has a real impact. We've seen comments made by community members, by businesses, translate into changes. And so it's really important that you comment on the draft guidance. And on the website, the state website, they have both the draft guidance and the comment forms. Now, Protect Our Neighbors is another part of what was announced yesterday, and it is basically the evolution of Safer at Home. It's the next step. And so they've released the draft framework for that, and they are taking comments. That comment period ends on Thursday. And I think it's really important to note that Protect Our Neighbors also, like a variance, requires that you meet a certain threshold of new case rate and hospitalization rate. And if we're not there, it's likely that Protect Our Neighbors at the earliest would be offered by the state on July 1st if we don't have cases low enough on July 1st, we can't apply to move to that stage. And something this came up in the last session, it's not just about opening up more. If we continue to have more outbreaks, continue to have more people getting sick, then we could return to stay at home. So it's really important, again, practice social distancing, wear your masks, and follow the framework set up by the state. These are, vetted by public health experts to try to figure out how to open safely. But we have to remain safe or they won't let us open. So quickly changing gears, I just wanted to quickly go over limited healthcare guidance. Really nothing in the current order has changed for a number of weeks. I just want to sort of hit on a couple items. Indoor spaces can now hold 50% of the room capacity up to 50 people. And why that's important for limited healthcare is there are a lot of limited healthcare facilities that have shared spaces. And that means that those shared spaces could become more crowded, and you still have to maintain 6 feet of distance and wear a mask when you can't maintain that 6 feet of distance. So there are a lot of tools on our various websites, the state and the county, that talk about marking out paths to walk, things like that help minimize close contact between people. And in those shared spaces, that's really important. So I want to make you aware of those resources, but also make you aware that there's the chance that you're going to see more people in your business common spaces, and that you need to be thoughtful about that. And then finally, this came up last time, and I think Cammie's probably going to hit on it as well. And I mentioned it earlier. The Department of Regulatory Agencies provides sector-specific guidance for the sectors that they regulate. Things like acupuncture and massage, and they go into detail on both what is limited healthcare, what level is limited healthcare, what level is personal service, but they'll also say in some cases there are specific types of procedures that are governed under medical procedures. So don't fall into limited healthcare or personal service, and those may be possible in certain situations. And so you just need, we really want to encourage you, if you feel like you don't fit into either limited healthcare or personal service, look into this. They can help, that guidance can help you figure out how to operate in those situations. And just as a caveat to that, in most cases, you do have to be in a situation where you are performing activities prescribed by a doctor. That was originally a sort of a litmus test to tell if you were in limited healthcare or in personal services. Now it's another way to even slice it thinner and say there are certain situations where you don't fall under either set of guidance. You fall into a more stringent set of guidance that might give you more opportunities to do certain procedures, but you have to have even higher levels of protective equipment. With that, and sorry for talking so much, I will pass it off.
All right. Well, thanks, Jesse. My name's Cammie. I've been your kind of personal service liaison for the last couple months. I'm just going to reiterate some of the same things for personal services that apply to limited healthcare services as well. Is that recently the orders did change that we can go up to 50 people in a space. So especially for some of those larger salon places or service providers, this was good news. You still can't be beyond 50% max. And just like Jesse said, you still have to maintain 6 feet social distance when those direct services aren't being performed. So kind of walking through the spaces or maybe checking out retail products or moving from one area to another, you still need to make sure that you are keeping people 6 feet apart as much as possible. And like I said, it's going to be more crowded in there. So try to go with the fewest number of people you can successfully operate your business with would be sort of our general recommendation. It's not time to start packing people in there, even though that might be tempting. But because of the disease transmission rates, we just want to, you know, definitely minimize exposure as much as possible. And I'm going to go over some of the DORA specific stuff as well. So Jesse, you want to hit the next slide? So you estheticians, massage therapists, all of you have been waiting so long for clearer guidance, more guidance. It is coming. So for those of you who work in a medical spa, as of last week, I believe, I think it was last Monday, I can't remember the exact date, but they did make a slight change that says for those of you who are under physician authority, where the Colorado Medical Board 800 rule applies, which outlines very specific services that can happen under a medical physician, even if that's not necessarily, or that are prescribed by a physician, you're allowed to wear a face mask or a facial covering. Oops, I forgot my L there, typo, sorry, is allowed to come off. So you are able to basically act as a limited healthcare setting. And I have up the guidance where it says, in the DORA guidelines, for those of you who've seen it, Jesse, do you have it pulled up by chance to show them the DORA page? I could show them exactly where it is. I have it pulled up if it would help. And thank you to those on last week's who, you know, some of you found the DORA guidance, they updated. You found it quicker than we did, so we wanted to make sure everyone knew around it, but definitely check the DORA website, and that's why I wanted to show you if it, why Jesse's getting it up. But things that are allowed to happen where you can follow the limited healthcare setting guidance if you are under physician authority or prescribed treatment would be things like follicular hair transplants, lipoplasty, medical grade plasma energy resurfacing, Botox, lasers not on the face, chemical peels not on the face, microneedling. There's a list of the medical board 800 rules exemptions that are listed in the DORA guidance. So if that feels like that would be applicable to your setting and you haven't seen the DORA guidelines yet, please check that out. They're linked on our Boulder County Health webpage as well to help make it easy to find. If you don't have physician authority to do those things, you're still not allowed to remove facial coverings right now. Everyone still has to keep it on. You can't move it away from the mouth, away from the nose, and you would follow the personal service guidelines as you always have for the last few months. What is pending is, as of Thursday, the governor called out in his press conference yesterday that for estheticians and maybe some other specific professions that some non-mask client services are going to be allowed. We don't know exactly what that language is going to look like until they post it on Thursday, even though the governor called out estheticians directly, which is good news for a lot of you, that even if you aren't under the kind of the medical spa or under physician authority, you might, as of Thursday, be able to allow to remove masks for client services. Staff will still need to wear them, but the client would be able to remove their mask. I don't know if it's going to say estheticians only are allowed to do that or if other service providers are going to be able to do that, but the governor in a statement specifically called out estheticians. So for those of you who've been waiting estheticians for a long time to be able to kind of perform more of your normal routine work, it sounds like as of Thursday or as soon as that updated guideline is posted, you're going to get some relief in that sense. So
I wasn't able to find it, sorry.
Okay. That's okay. I wonder if I have it pulled up. I wonder if I can share.
You should be able to share your screen, yeah.
Okay, just a sec, and I'll pull it up so people know exactly what we're talking about.
While she's doing that, Jesse, the question about it is what type of workplaces have had COVID outbreaks? Retail, restaurant, you know, manufacturing. I know that there's a list actually on CDPHE's website where you can search by county on some outbreaks, but what type of businesses?
I don't, you know, I don't have that information. I did not get that from epidemiology. If we can,
let me see if I can find the link that I was sent.
Right.
The public-facing link. I'll see if I can find that while we're doing.
Perfect. Thank you.
All right. Can you all see the DORA guidance? Yep, okay, great.
Yep.
So if you don't know how to find it, if you just search DORA Colorado, it's going to take you to the front page, and on the very front page, it's going to say like their main COVID-19 link. You can link on that, and then it's going to basically give you a bunch of different sectors who are regulated by DORA. And within that, under, I think it's called beauty and spa or beauty and cosmetology possibly, this is the document that gets pulled up. Explains a little bit more about what the state order is. There's a cut and paste of the state order and guidance that is this exact same match as to what's on the state's website. And then down below are basically frequently asked questions. This is a live document. Every time one of the updates comes out, this gets updated. There's also one specifically for massage and massage therapists and massage therapy that looks almost exactly the same, but has different Q&A explanations on there for you. But if you scroll down basically to I think it's page 6 or 7, right here it talks about those who are working for a medical spa or under the delegated authority of a physician. From here through here, this is basically new information that was added as of last week. And again, we expect this to be updated again on Thursday or Friday, that will have more clarity around who is allowed to remove a mask and who isn't. But it sounds like estheticians are going to be able to remove client masks to be able to do a lot more of that facial work than they've been able to do before. So watch this document. It will always be live and up to date on our website as well. But this has a lot more, DORA is putting out more detailed clarification around the state's guidance and what's just listed up in here, which is what you find on the state's website, if that makes sense, the Safer at Home website versus DORA's website. I should have clarified. They're both state agencies, but the Safer at Home is kind of the general guidance, where DORA is basically providing a lot more kind of in-depth clarity around the Safer at Home generalized guidance. So hopefully you all have seen that. I know a lot of you follow that very closely already. And again, thank you to those who share this with us. We're watching closely too, and we'll be watching on Thursday or Friday for when the next posted update is available. But this does right now currently spell out exactly what is allowed and what isn't allowed. Like Lucy said, it changes expected to occur on Thursday. So just if we want to go back to sharing your page.
Absolutely.
And keep going through the presentation. But in short, like we've been saying for the last few weeks, if you don't have a physician prescribing the treatment, you follow the personal services guidance. If you have a medical physician prescribing a certain treatment, you can follow the limited healthcare guidance. And that's really kind of just like the clearest way to tell the difference between, you know, what you should be following. And for some physical sites, you're following both depending on what site type of service you're providing. You're not necessarily limited to having to follow one set of guidance. Okay, so we can go past this slide. So places of worship and pastoral services have been under personal services. We aren't necessarily directly kind of managing this. This was sort of a summary from last week. I just wanted to re-put it out. But every Tuesday now at 1 o'clock is where sort of events is getting kind of discussed in more detail in a webinar. And these places of worships, that's where events is sort of landing, because they're larger groups, bigger crowds. They have different set of rules that are similar to graduations, kind of concert, those sort of larger gathering. So you're now going to be sort of be addressed within sort of our events webinar. But this was just a summary in case some of you are still finding your way to this personal services update, that you might want to consider the 1 p.m. sort of event webinars moving forward. But here's just a general summary. Essentially, you have three main buckets that you're required to follow. It's around capacity limits, social distancing, and cleaning. And then there's a lot of other strongly recommended guidelines that have been made available. There's a whole page on the state's Safer at Home website now for just places of worship, where you can find all of those details. But these were basically your big buckets. Looks very similar to other people, but you have capacity limits, social distancing limits, and cleaning limits, which I think seem, you know, pretty straightforward and comparable to the other sectors at this point. So we can scoot past this one. Jesse, we won't spend a ton of time on it, but just wanted to make sure people knew it was there. Here we go. This was a resource. We kind of already did it. I just wanted to make you aware. Here are the list of all the DORA specific areas that they have guidance on. So if you fall into any of these kind of lists I have below, acupuncture, barber and cosmetology, chiropractic, dental, massage therapy, DORA has specific guidelines for you where you can get some more of the kind of frequently asked questions like the example I just pulled up. And then there's some for the rest of these areas. They don't necessarily fall into our sector, but I just wanted to make sure that everyone was aware of what was there in case it's helpful, or you can send someone else there who you might know who works in some of these other fields and might need some of that clarity. And then I'm going to kick it over to Angel. We know there's a nice overlap between a lot of the personal services and limited healthcare facilities also have retail sections. So she's going to talk a little bit more on that for our collective behalf.
Great, thank you, Cami, and thanks, Jesse and Corinne. So many of you may have attended some of the retail-only sections, but this is going to be a review of just what is expected of retail for retail guidance. So it may be something that you all have already attended. If you want to go or listen to, if you want to go more in depth, you can go look at the previous retail sessions that we've held previously. So I just want to talk about how signage is required for retailers. And what we mean by signage is basically telling people to wear masks, having up the social distancing signs at the beginning when people enter your establishment, and then also having floor decals or markers on the floor to encourage people to social distance. We all know that some people are getting a little bit fatigued about all of the signage and everything around us. So sometimes the signs are not going to be enough to encourage people to maintain that 6-foot social distance. So it's always good practice to also have a verbal announcement, either through a PA system or having somebody who's greeting somebody coming into your establishment, letting them know that social distancing is really important to control the spread of COVID. Additionally, if you have aisles in your store or in your establishment, you're supposed to have one-way aisle markers to control the flow of traffic so that people don't come face to face. If everybody's flowing in the same direction and 6 feet apart, then you're going to be less likely to spread the virus. Also, we have had questions before about aisles being 6 feet wide and if they have to have markers, and they would still have to have markers because it's impossible, or still have to have one-way markers because it's impossible for people to kind of cross without coming into contact or without being closer than 6 feet. Additionally, within retail, there is a requirement that we have plexiglass at registers where it's not possible for the employees and the customers to maintain 6-foot social distance. So that is a requirement, and we do have a resource list on our COVID page for Boulder County that is, it's called PPE resources. And you can go and look at different plexiglass vendors on there if you don't have the plexiglass installed yet. And really that's just, people are gonna be standing there at the checkout for quite a while. And it's almost impossible to maintain 6 feet at that point with the financial transaction. So that's why you have the plexiglass. I'm sure a lot of you have been to the grocery stores and seen how they're set up. They've been leading the way on a lot of these configurations with the one-way aisles and the floor decals and the plexiglass, so they're always a good example to look at for retailers as well. Additionally, for retail, you do need to clean and sanitize high-touch areas. So what that means for retailers can be, the handles going into the store or the establishment, but also those baskets and those carts. After every time a customer uses them, they need to be cleaned. And you can use, spray cleaning solutions or the disinfectant wipes, but those should be cleaned after each use. Additionally, something that might be a little bit different from the other sectors is that retail has a 50% capacity. And that 50% capacity is including your employees and your customers. So what that means is that you should adopt certain strategies to minimize the number of people in your establishment. So if you can move, like restocking shelves, doing product inventories to the after hours when customers aren't in your establishment, that's one good way of getting fewer employees in the establishment at the same time. And then also curbside is always a good practice. So there's various ways you can set up curbside. People can call and order ahead. You can talk to them over the phone about what types of products you have. And then, or they could actually, you could set up a queue outside and with markers maintaining 6 feet from each other. And somebody could come up and say, I'm looking for, you know, a shirt that is long sleeved. What do you have? And you can bring out a couple of options. It's not ideal, but it keeps that 50% capacity of your store down. And we do have some guidance on our Boulder County curbside guidance on our website for you to look at, just to realize like what the best practices are, and then also just how that should be established. Whenever possible, you should be encouraging like contactless payment, either paying online ahead of time or over the phone. Jesse's moved on to the cleaning of quarantine retail items. Oh, that's good. We're yeah, really good there. So one of the safer at home issues that pertain to retailers was some guidance on if employees are handling returns, that they must have PPE, they must have gloves and masks to be able to handle those returns. But it also encourages businesses to set up policies that really limit those transactions, those returns. So there are some retail items that are really difficult to clean. So we're talking about clothing, right? Generally speaking, clothing is really easy to clean. You just wash it. But when you're trying to sell a shirt or pants or something along those lines, you don't want to necessarily wash that. So we do provide guidance on quarantining the retail products. This really came out of the fact that we were getting a lot of questions about steaming clothing or using UV light cabinets, and really our our safety point of contact within Boulder County really is strongly discouraging the use of any steamers or UV lights. And the reason why is because they're really difficult to administer and they're costly. So what we are saying is that you can limit the risk by prohibiting people from trying on the clothes in the store, or limiting if they can return the clothing. If you don't want to limit that, then you can basically you can also set up policies around if you touch it, you buy it. Also, like harder surfaces, like if you're selling a bike, let's say, those are easier to disinfect. So it might be easier to let people try those bikes in your parking lot using curbside, and then cleaning, disinfecting those bikes afterwards. But if you have to quarantine the soft items, it's good to do it for 7 days. And we just want to admit that the science is constantly evolving on this because this is a new virus, but really 7 days is probably going to be the safest. And what you can do is if somebody tries on clothing, you can put it in one of your fitting rooms for 7 days. And then after that, you can put it back into the rotation on the floor. So one thing though that you want to be careful of when you're quarantining the soft items is that you don't want to make sure that you don't recontaminate a piece of clothing. So if somebody tried on a shirt 3 days ago, you're only 4 days from that 7-day window being closed. But if you put a new shirt that had just been tried on in contact with that old shirt, then that old shirt has to be quarantined the same as like the newer item that you just put in there. So if you are going to be quarantining your clothing, you want to make sure that you keep them in separate piles for 7 days. So have like one pile for Monday, one pile for Tuesday, and just make sure that those piles don't contaminate each other. Also, if you have like a thrift store, laundering is the most effective way of cleaning clothing. So just keep that in mind. And also just one of the best practices is communicate to your customers to avoid some of those conflicts or avoid some of that, those hard feelings. You can let them know ahead of time. I'm sorry, but we have a policy where you can't try things on, or you can communicate to them that if you buy this, we are not accepting returns at this time because it's difficult for us to clean or quarantine the items. So you can communicate that ahead of time. And again, just down at the bottom, that strongly discouraging purchasing any big steamers or any of the UV light treatments. They could be somewhat effective in certain situations, but they're just expensive and it's not worth the investment at this point. So next slide. So these are a list of all of our other office hour sessions. You can see that we've grouped them mostly on Tuesdays, and then we have a general session on Thursdays. So I don't know if these categories have been addressed in other sessions, but that's pretty much the end. If you have any questions or any like report complaints about people, you can contact this COVID, or organizations, businesses, you can contact this Feedbz. This is the email and the call center that we get calls from the public or from employees who feel like their business isn't following the safer at home orders. And so we will use that opportunity to reach out and talk to businesses to provide information on how they can be compliant.
Thank you, Angel, Cami, and Jesse. So we have a few questions. And then we have the question about where were outbreaks. So I posted, the state site is pretty, pretty good about tracking data. It is a little bit back. It's a little bit back, so you can only get data through June 7th on some things and so forth. But it does list outbreak facilities. Some of those outbreaks, we've seen recent emails from, the CU Chancellor saying some of these might have been tied to, students partying or some of the peaceful protests. So they're not always necessarily tied directly to the business in some cases. So I posted that. We have a question about if someone tries on a hat, would that hat be required to be quarantined for 7 days? And then maybe talk a little bit about the required to quarantine, a little bit about that guidance that's been put out and, the science piece a little bit more.
Yeah, so really this is a best practice. If you look at our document that we have on our webpage, you'll see that on harder surfaces, the virus can last longer. I think it really just depends on there's so many factors that go into this and we can't say 100%. Some of the times it could be like 3 days that would be sufficient, but there's just so many different materials and products that we can't give that that clear guidance that if it's made out of this type of material, 7 days, and if it's made out of this, 3 days. So really you're gonna have to use your best judgment on that. Those are guidelines and that's the best science that we have at this point. It depends on what it's made out of. If it's a hard hat and you can easily wipe it down, you can wipe it down and put it back on the floor, right? If it's something that's softer that you're not gonna be able to successfully clean, then yeah, you probably would want to have it quarantined for 7 days.
I was going to say, for some of us, for a lot of the people on the call, they might have like the salon type settings or healthcare settings where they have a product probably in a plastic bottle or maybe even like some sort of harder product. So just to reiterate, it would be okay for them to clean it down, wipe, at the end of the day, put it between customers if they have the staff capacity to do that, and that would be fine.
Yeah, that would be perfectly fine. That would be just like one of the carts or one of the baskets, right? You just wipe that down after somebody touches it.
Great.
And I've seen, places have like a place where they put a product, someone touched a product, please put it over there, and then they clean it down and put it back on the shelves so it's not put back on the shelves immediately. I've seen a little bit of creativity out there and helping businesses, restaurants, retail, all across the board keep track of what they need to clean, because
yeah, that's a good example. I mean, just pens in general, when people are signing that credit card statement, I've seen there be a cup full of clean pens and a cup for your dirty pens. So people will grab from the clean pen, sign their receipt, and then put it in the dirty pen. And then you only have to clean all of those pens at one point later, like when you're running out of the clean pens. So yeah, people are really getting innovative and really managing this well.
Okay, so we had someone, comment that they walked into a retail store in Boulder County and nine people, whether it's employees or others, were not wearing masks. And so maybe encouraging individuals to make note of when a business isn't following. This person specifically spoke to the manager over the phone, and they were, it went well. But maybe encouraging usage of signs, following these practices to ensure customer and employee confidence. You guys can talk a little bit about some of the complaints you get. You do get complaints from customers and from employees and so forth, and how that affects. And also, if you get a call about a company, what do you do?
I don't know.
No, go ahead.
Oh, I was just gonna say, from a retail perspective, we will call and we will ask if they have the signs posted. Do you have the signs letting people know that they need to wear masks? When it has to do with the employees, we can definitely follow up on that much easier, right? Because they are responsible for the safety of their employees, and it clearly states in there that they have to have their employees wear masks. When it comes to members of the public, that's a little bit harder to enforce. And I think we've seen some of the scandals in the news, or some of the conflicts in the news about this. Really, we encourage people to use messaging to try to encourage people coming into a retail establishment to wear a mask, and really just explaining to people that it's impacting your bottom line, because people who don't feel safe going out shopping, they're not going to come out and spend their money at your store. So I think just framing it in a way to where it's not just about that individual action, and it really is about your livelihood, is probably a good tactic. We don't want people getting into the conflicts where they are getting escalating the situation with a customer who's coming in. But it is good to have the signs. You have to have the signs up, and just reminding people to wear them. Sometimes you can provide masks if people don't have them as well, and following that script that Jesse talked about earlier. I don't know if
And
Jesse,
as a reminder on the signs, we do send you out example signs that you can use. And then we've heard a lot of companies doing the PA announcements. And, you've all heard it at a grocery store. You've heard it at some other places. To prevent the spread, please follow, the mask, the one-way traffic, those types of guidances that you'll see signage about all over the place. So.
Yeah, I'll just say that in terms of our normal process, if people see something that does not look right, if they see a business that's not following the rules, or even a customer that's not following the rules, the number here and the email, you can contact us. And what we do is we reach out to the business. It's not a punishment. We're just checking in to make sure that the business knows the rules, knows how to follow the rules. We do have the option to move to enforcement. We do not want to do that. It doesn't help anybody to enforce. What we're hoping to do is educate in most cases. So whether, if you have questions, we want to answer them, and you can use these sources. If you have concerns, you can contact us. And if you have a report of a business that's not following the rules, please contact us and we'll reach out to them. And again, it's not punishment. It's about trying to make sure that they understand the rules and the importance of following those rules. And that goes back to that outbreak discussion.
And there, especially, in retail and restaurants, sometimes the manager's not on duty and you have young employees, and communicating to those employees the importance of making sure these rules are followed, also for the bottom line, how to have those conversations, how to make sure the signs are being followed, and so forth, so that we can continually get that information out to employees who are talking to customers as well as managers. It's not just about the manager level, it's about everybody.
I think, in the last few webinars, we said, share the guidelines with staff and management, not just keep it at management, so then everyone knows what the rules are and can help hold each other accountable and remind each other, as well as help educate the public. The more people realize what the guidelines are, just the better it is to help kind of that group take over to sort of like, let's make sure we're all doing the best we can to follow these guidelines so we don't put getting back to work at risk.
And right now with, increasing numbers, we're at risk of not being able to move on to some of these additional phases that could be announced later on, because as a community, we need to continue to be diligent in our efforts and not have outbreaks. So a good reminder, one of the questions, a good reminder about mask usage, it needs to be over the nose and mouth, and that seeing it under the nose often causes lack of confidence because people are not wearing the mask correctly. Going through some of the comments and making them into questions and so forth. One last question and then we'll close this out. Is there any anticipation of a craft type retail at fairgrounds in the foreseeable future where hats, scarves, or wearable art could be present? So you're thinking of some of those small shops that are at farmers markets or at the fairgrounds?
I mean, I think the current feedback form would be a great place to give that feedback that's desired as they're looking at indoor and outdoor, like larger gatherings. So that would be a great place to get it. And just to reiterate the point that brought up earlier, the feedback is making a big difference. I mean, I know for a lot of the salons and the estheticians and all the feedback, all the things, it's slow going for all of you, but it's being heard. And that's what's getting to all of these changes, is that people are providing the feedback and it's making a difference. So if there's still things missing in the order or something that hasn't been thought of, the governor admitted yesterday, I didn't think about when we said no mask for this or not, like he can't think of everything either, all of his advisors. So this feedback you all are giving, so use these feedback opportunities to tell the state whatever it is you want them to hear so they know they need to consider it in their future drafts.
And I'll send links to specifically the indoor events, outdoor events, and the movement to the Protect Our Neighbors feedback. But as Cammie's pointed out in a lot of sessions, at the very bottom of every state, CDPHE is Colorado Department of Public Health and Environment. On the bottom of every one of their pages is this form to be able to just give general comments. Use that. It has been used a lot, and we've gotten a lot of, I think there's been a lot of recognition to the things that weren't thought of with businesses or clarifications that needed to be made. So please do that. I don't see any additional questions. We appreciate everybody attending, for getting your questions answered, providing feedback, letting you hear updates. And hopefully next week we'll have those additional updates and we'll have some good news for our estheticians.
Definitely watch Thursday or Friday. They don't always publish it like right away, even though it'll change on Thursday. It doesn't necessarily get posted. So watch for sure by Friday, because hopefully the official language will be posted by Friday, but sometimes there's a delay. But for sure next week on next Tuesday's webinar, we'll be going over all the new official guidance to make sure everybody's aware of it. But just know it doesn't always get posted right away, even on the date that they say it's now live. It's not always readily available that same day. So just be patient, but we know it's coming. So it's good news for a lot of you, I hope.
Yeah, I think all of us are like refreshing the state site all day, waiting.
Oh, we're doing it all day on those days.
Yeah.
Trust us.
I am too. Too, so that I can get that information out to people on these calls as quickly as possible.
The whole team. Has anybody seen it yet? Where is it? Anybody seen it?
Yeah. All right. Well, everybody have a safe weekend or a week. I guess it's only Tuesday. I can't keep track anymore. And if you want to do any live Q&A, come to the Thursday session with Jesse and I. And we'll see you next week. Thank you.
Thank you. Thanks, Corinne.
Thank you.
Tammy, Angel.
Thank you.
Bye.